it all started with the blue pills. So what got me into research was the frustration of not knowing what was causing young people to become unwell after taking party drugs.
Well, I guess the best thing about research in particular is the people. So people comes first. By people, I mean the researchers themselves along with the patients. You know that you're working to help society and help people with whatever condition you're working on. And having a group of people who have that motivation of trying to do things better is inspiring.
Well, I've been honoured to be recognised for the work that I do, but I think what actually motivates me is talking to patients and people who've survived sepsis, because ultimately that's why we do what we do. I think the thing that constantly drives me on is to talk to patients, realise the difficulties and the problems that they encounter, and try and find ways that we can actually improve the outcomes and hopefully avoid people developing serious complications in the future. A clinical trial I'm currently leading is looking at how we resuscitate patients who present to the emergency department with septic shock and low blood pressure. And we're comparing two different ways of treating low blood pressure, one using intravenous fluids and the other using medications to try and restore the blood pressure. And this is work that we've been doing for a number of years. We're about to embark on a large-scale clinical trial across Australia and New Zealand.
It's no use if you do a surgical procedure on a patient but then they spend 4 months in hospital because they've got an infected joint. And what we are focusing on is examining ways to reduce these complications for patients, to improve the quality of their care and to improve their safety. Or if you've got a patient who has a heart attack or a stroke or severe delirium after surgery. So these are the type of outcomes that we're focusing on trying to reduce the risk of afterwards. I have seen changes to patient care in terms of the type of anaesthesia we provide and the way we approach preoperative preparation of patients, the way we approach postoperative management of blood pressure and fluids. A lot more focus on outcomes that are important to the patient. So particularly heart attacks, strokes, delirium, awareness. These are very important outcomes for patients. And I've seen subtle changes in the way we provide anaesthesia to patients over the years that has resulted in a reduction in these complications.
Well, as a clinician, we see a lot of people who we can make better in Royal Perth Hospital. But we also encounter people who run into problems for reasons we don't fully understand. We have sometimes relatively young people under the age of 50 who come in with a very large heart attack. And even when we go through all their traditional risk factors, it can be very unimpressive to see, well, why did this person really have such a nasty event? The reason we have a number of treatments already is because of all the research that's happened in the past. And in fact, it's transformed the landscape. Not more than 3-4 decades ago, if somebody was admitted with a heart attack, they were just literally observed and everybody kept their fingers crossed that everything would be okay and they would leave the hospital. Now, it would be most unusual for somebody not to leave the hospital. And we have a whole range of treatments that incrementally help to keep people safe and improve their quality of life.
Some of the research we have done indeed has led to significant improved outcomes for patients. We have a special interest in high blood pressure, which is the biggest killer worldwide, kills around 10.5 million people per year across the globe, and around a third of the adult population in Australia suffers from elevated blood pressure. We have developed certain technologies, interventional approaches rather than medication, to try to lower blood pressure. And just in my clinic last Tuesday, I saw a patient who had a procedure some 3 years ago, and her blood pressure is very well controlled on less medication. So I'd really be proud to say that our research translates directly into better outcomes for patients.
Our department has recently done some studies into how long people fast for in hospital before they have surgery, and we found that those who fast for longer periods of time have worse outcomes in terms of their length of stay. That has led us down the path of seeking alternate feeding options such as peripheral parental nutrition, and we were one of the first hospitals in Australia to use that. We're currently doing some research in that, and what we're hoping for is that will reduce the patient's length of stay, which is great for the patient, but it's also good for the health service.
Yeah, so the research we're doing with COVID is looking at the hospital resource use. So how many people come in with COVID or COVID-19 like symptoms, how many people have had the vaccine, and how that affects the resource that's required to treat them. So how that will affect people in the future is if they present with COVID or another viral illness, that we'll have the amount of resources that are required to treat them.
So evidence-based medicine would mean asking a question, developing a methodology to answer that question, collecting participants, recruiting participants, collecting data, and going ahead in a scientific and rigorous way, free of bias hopefully, to answer a question definitively. But the important thing about evidence-based medicine is it's not just about the evidence, it's also about incorporating the patient's perceptions, the patient's experiences, and the clinician's judgment, the clinician's experience as well. So it's kind of a three-pronged approach that puts the patient at the centre. So I'm a physiotherapist and I'm employed at the moment by Curtin University, and I actively collaborate with Royal Perth. Our main area of research focus is looking at people with chronic lung disease, in particular people with chronic obstructive pulmonary disease, and trying to improve the quality of their lives. The main way the patients benefit from our research is that when they first come to us, they're very breathless, they're very fatigued, they have very low quality of life, they're often quite anxious and depressed. And when they come to a program like pulmonary rehabilitation, we teach them ways to exercise safely, we help to improve the condition of their lower limb muscles and to their cardiovascular system, and this allows them to be less breathless, less fatigued, engage more in day-to-day life and improve their quality of life.
Here at Bentley Mental Health Service, the research we focus is on mainly on the area of cognition in people with refractory schizophrenia. Refractory schizophrenia is people who are not responding to the usual treatment and has got severe disabilities in the many areas of functioning, such as social and occupational functioning. So our research aims to improve the cognition through a novel program broadly named as cognitive remediation or cognitive training, which is usually imparted through computer-based training. So we are perhaps the only centre in Western Australia which has been doing this cognitive training in a systematic way and evaluating the outcomes. We are able to do a multi-centre trial, which is relatively properly set up with a randomized controlled trial, and we hope to finish the trial in the next few months. The early results are promising, and one of the advantages we have is that we have been able to translate some into ordinary clinical practice.
So it started with the blue pills. A bunch of kids came in on New Year's Eve who became really quite unwell from having taken these blue pills. So our standard way of treating them is just to manage them symptomatically. If they are agitated, we would give them medications to put them to sleep. If they are sleepy, we'll wait for them to wake up. And sometimes we have some antidotes that we can give them. But we have no idea what it is that they've taken. So I'm a clinical toxicologist and have been so for many years. And I would get phone calls saying, what is it? What has my son taken? You know, what has my daughter taken? What's made them crook? It became quite clear that we needed to have a way of finding out what drugs were causing people to come into hospital, knowing how to do so, and also, is it a useful exercise? So that started our pilot project in 2016. We have formed collaborations between individual hospitals and a forensic lab to start to do around the country what we're doing here at Royal Perth. The project is EDNA, the Emerging Drugs Network of Australia. And that's a clinical registry which aims to provide objective evidence of what drugs are causing harm out in our community. When I can actually tell patients and their families what drugs are causing their son or daughter to become so unwell, there is a look of relief on their faces because it helps them understand what happened, and it helps provide a bit of closure for them for what is really a very traumatic event. These kids are normal kids. They could be you or I our children. My aim is that I don't want any other family to have to go through what these parents have had to go through.
Everything starts in mom's uterus. Everything starts maybe with their grandmother, because it all passes through the different generations. So we really have to educate our women, and research really helps us. That is the most important part of the research. We won't be doing all these things if we don't have evidence, if we don't have research. We need to base our discussions on evidence and research, which is coming up in a huge way.
The best thing about research is learning something new, and if you've got to have that curiosity to know what can we be doing better, how can we improve things, and without research that isn't possible.
So we're often dealing with very difficult situations, and the ability to provide a potential solution and see that solution evolve and bring benefit to the patient is a wonderful experience.
Research is not for the faint-hearted. It's a lot of work, it's a lot of blood, sweat and tears, but ultimately when you think about what you're trying to do in terms of benefiting outcomes for patients, when you see your research results taken up by clinicians and changing the lives of patients, that's what makes it all worthwhile.
The main focus of our research is on staff wellbeing. So helping staff to understand themselves and what triggers their own emotions so that they can help the patients. So it's about looking after self and therefore being able to look after patients better. We care for people. At the heart of it, we're all people, we're all vulnerable, and people in hospitals are really vulnerable. Their life's been turned upside down, and the staff caring for them get affected by that as well. So we're just caring for the people who are caring for patients.